Good afternoon. Today is Friday. Yay, Friday. And it's like 3:50 in the afternoon. Um, I had gone to a plasma donation place to see if I could donate plasma this morning, and I have to say it was fairly irritating because about 10 years ago, I went to one of the plasma centers up in Cheyenne, and they put me on a permanent deferral list because of a medication I was on at the time. And no one's ever been able to give me a reason as to why. And the medication was given to me by a doctor that I'm pretty sure was just using me as a guinea pig. And there's possibilities that the medication that he had put me on could be behind my dystonia. It's not, I've been told that there's there's probably more than that, but three major known reasons for dystonia, and that's brain damage, genetics, and medication reaction. And the medication that he had put me on, this 10 years ago, probably 8, 10. I think I got off it about 8 years ago. I don't know. Is on that list of actually one of the more likely candidates to cause dystonia, or a type of dystonia. And at the same time, because I was on that medication, I got put on this permanent deferral list, which means I can never donate plasma. Which really, I went back thinking that just to see if I was, on that list still, or if things had changed, because, it's an antipsychotic, and I was put on it because of anxiety. That's why I say I was pretty much his guinea pig, because he's trying to see if it would help the type of anxiety that I had. And he is giving it to me in small doses, and all different types of antipsychotics. I mean, we went through a list of about 4 or 5 different brands, and all in very small doses to try to help me with my anxiety. And I guess it's a good reason to question why you're being put on certain medications, because nowadays, some of these medications, their side effects, even though they're minute possibility of it happening, there's still possibilities of happening. There are people out there that have different types of dystonia that absolutely cripples them, and it's 100% proven that it was because of a drug. And there's other people that have had different reactions to different drugs, and so, I'm nowadays, because of all this, very reluctant to let anybody put me on any type of medication. Especially any type of medication that alters the chemical and biological stuff in your brain. Because, it was ridiculous. I mean, it hasn't been my type of dystonia. I was told it's very unlikely that it was caused only by that, but there's a good chance that it increased the either their severity or made it have an earlier onset than what it might have. But they're still trying to figure out, because mine is either genetics or medication, or there's also this large chunk of dystonia that they just don't understand. But so it really frustrated me that I'm still on this list because of a medication that I was put on for anxiety. And, they've never been able to give me an explanation as to why I was put on the deferral list. It's, we make medication out of this plasma and stuff like that. Well, it's been 10 years since I took that medication. If it's still affecting some sort of, any part of my system that would create plasma, or be involved in the plasma, that concerns me a little bit. I think it's more because it's an antipsychotic, and they're concerned of the people that, aren't mentally stable, who, take it for antipsychotic, because of psychosis, stuff like that. And it just frustrates me. One, I'd like to know why I'm on that deferral list. Is it if it's still could still be in my system, that kind of worries me. Or two, if it was because of they're concerned of the reason people are given antipsychotics, and then that just really pisses me off, because one, people who are taking the medication usually are, their psychosis is under control. And even if, there was a lot of doctors that were giving people antipsychotics for some of the dumbest flipping reasons. And I can't remember, it's what they call it. When they treat someone with a medication, it's like an off-label diagnosis or something. I don't know what they call it, but where they're giving people medicine because it has, some of the side effects actually help treat that, or they have, they help treat certain things that they're not meant for. I've heard of it happening a lot with certain medications being given to people to help them sleep or help them lose weight when it's not meant for that. And so, yeah, now, because of this one doctor and these medications, I am very picky. And some of my doctors have been kind of, frustrated with me because, I've got depression. And I won't let them put me on an antidepressant because it affects the chemical makeup or chemical balances in your brain. And, after the dystonia stuff, I'm really reluctant to do it. And I mean, there's been other situations where I'll say, I need to know all the details about this medication. And I think you should do that anyways, because it's your body. And while, yes, we need to understand that doctors, we can't be sitting there and think that we know more than the doctor, but we also need to understand what's happening. It sucks when doctors treat you like, you shouldn't be told, or, if they tell you it's just going to cause worse stuff, or they think you're a hypochondriac because you have issues. For 5 years, I dealt with doctors like that thought I was being a hypochondriac because of my dystonia. Oh, it's all psychosomatic. You can stick the psychosomatic stuff right up the rear end, because 5 years later, I've got an official diagnosis of dystonia, and I'm getting it treated. Do you know how much further along I'd be in my treatment if people had stopped assuming that it was because of, it was psychosomatic, or I was being a hypochondriac, or making things up? Come on. You guys, the doctors there's a lot of doctors out there that need to change that perspective, because even if, say it was psychosomatic, there's a reason that person is doing that. If you're having something that is psychosomatic, which psychosomatic means that it's in your head, pretty much. Obviously not an official definition, but okay, so if someone comes in and their hands are curling in pain, and it's happening all the time that they're awake, even if that is psychosomatic, maybe you should try to find out why that's happening, instead of just like, well, it's all in your head. I'm sorry. This is getting onto a topic that I'm very passionate about. I do not like it when doctors write you off because of it being psychosomatic, or you're being a hypochondriac, or you're overreacting, or you went to WebMD and learned that your symptoms could have been this and this. Okay, so if that's the case, explain to them what would really happen in that case, or explain to them how it's not, something that they would, stop acting like people are complete idiots and help them out. Too many doctors are out there that are in it for the paycheck. And I went through several doctors because of that. And I am very, if I go to a doctor who is going to treat me, I expect an explanation as to what's going on, because I've been on the wrong side of people making assumptions and people treating me with not experimental but off-label treatment for some of these, medications, and I may have paid a price because of that. I don't know if the dystonia is from that, but there is a good percentile chance that it was. And I've seen people who have also paid the price much worse than I for medications that they should never have been put on. And, with everything that's happened with my dystonia and, other things with the weird blood pressure, a lot of the other things that I've had to deal with, I've had to go into the hospital before. And I've been treated like someone who just wants attention. And that infuriates me. Because then I'm sitting there not wanting to go to the doctor or to the hospital because I'm afraid they're going to think that I'm going in there because I need medication or I need attention or whatever. That's bullshit. I'm going there because I think there's a good fucking reason that I need to go to an emergency room, a doctor visit, or an urgent care center. And I am the type of person that even if I think something might be psychosomatic, I think there's got to be a reason for it. Okay? So I don't care if the doctor comes back and says, well, it's probably psychosomatic or something like that, and we need to find out why. Okay, so if in my subconscious I'm having some issues and it's causing me to outwardly display them in pain or migraines or something, I'd like to know why. I'd like to fix it. I'd like to talk to the person I need to fix it. I mean, I went through that for 5 years until I finally got diagnosed with dystonia. And that's because I went to a specialist who is specialized in movement disorders. But not once did I have a doctor say, hey, maybe we should have you talk to a specialist of some sort. It was all, well, it's most likely in your head, or we don't know. And that is one of the things that will absolutely infuriate me, is when I hear a doctor say, we don't know, and that's the only thing they say. How about, we don't know, let's work on figuring it out. So frustrating. And there are good doctors out there. I've got a primary care physician that I'm very happy with. I've got a neurologist that's, the movement specialist that I'm extremely happy with. I've got another neurologist that, is working with me on my migraines to try to figure them out. And he's actually trying to figure out what it is. He's not just saying, I don't know, and stopping there. There's been so many times that I've gone either to the hospital, to a doctor, and heard, I don't know. And that was it. That was the it of it. Or it's in your head, and that was it. Okay, well, glad to hear it. Now what? You just want me to figure this out on my own, you jackass? But then when I do find doctors, it took me a while to find these doctors, they are willing to try to figure it out. And it is very refreshing. But my history with certain doctors has, I guess, kind of just spoiled me. And I know that there are people that take advantage of the system, and there are people that, they literally are just there to talk to someone, or they're a hypochondriac. If they are a hypochondriac, there's a reason they're a hypochondriac. Talk with them, work through it, send them to a psychiatrist to find out why, instead of just, oh, well, I'm sorry, I can't help you because I assume you're a hypochondriac. Or, oh, this one really got me. I had a growth on one of my tonsils. And the doctor that I had at the time, a family practitioner, was really concerned and sent me to an ear, nose, and throat guy. The ear, nose, and throat guy, biggest jackass I have ever seen. I'm sitting in the in the examination room, after being, directed there by one of the office staffs. He brings in a salesman to look at a piece of machinery he has in that waiting room, and because he wants to buy more while I'm sitting in the exam room. He brings a salesperson into that exam room to look at one of his pieces of machinery. Right then and there, I knew that this was not going to be a good meeting. He sits there, talks to this salesperson while I'm sitting there, and the salesperson's looking at him like, you jackass. And you could tell a salesperson was extremely uncomfortable with it, and this guy's sitting there talking to him about sales stuff in the exam room with me. And then they go out, and he comes back in, and he looks at it, and, he's kind of like, he sits there, and he looks at it and says, it's kind of like a pimple on your tonsil. And you can pop it yourself, or you can, it'll go away. He didn't really take that much effort into looking at it. So I go home and I try to pop it myself. And it is hard. It will not pop at all. And I know this is kind of gross, but so I go back that same day, because I call him. I'm like, I can't get this to do anything. And so I go in, he comes in, and he's like, so you want me to pop your tonsil pimple? And he acts all disgusted. And it's like, I am in here because I can't get it done. I want to know what the hell it is, because it's a growth on my tonsil. And so he sprays it, and he goes in there before the numbing spray had actually taken effect. And he's trying to pop it, or to, drain it or whatever. And he can't. He's like, oh, well, this won't, I can't. It's too difficult. It's hard. And it's like, well, okay, so you told me that this was a flippin', absent or whatever on my tonsil, and now you can't even get it to pop, and it's no longer what you think it was, because it's hard, and it's not letting you, you're having to cut into it to actually get it to do anything. And so he played around with it for about a half an hour, and he couldn't get it to pop. And he's like, okay, well, we're just going to have to, let it do its own thing. And that was it. Never, didn't schedule me for anything else. Didn't try to figure out what it was. Didn't biopsy anything. It turned out to be a hard mass. It wasn't a, absence or, something filled like a tonsil pimple or, something. And that's absolutely ridiculous. I mean, the way that doctor treated me was beyond irritating. And I was livid. And then I get a bill because I didn't go to, because they had scheduled me for a, checkup, like after my first visit, not when I came back in the second time that day. But I told them that I needed to come in that day, and they said, okay, we'll cancel that one and just have you come in today, and again today, and see what we can do. And the people up front were really nice, the people at scheduling everything. But not only did I get a bill for all the crap he did, which he didn't do anything because he left it in there saying, oh, I can't get it to come out. Not only did I get the bills for all that, which I've never paid, because you don't pay for extremely poor service like that. I also got a bill for that other appointment because they never canceled it like they said they would. Well, that really pissed me off. I mean, I can understand that that was an error and stuff like that because they had told me that they were going to cancel it, and it just didn't happen. But that just infuriated me even more. Um, and oh, here's another experience I had with a that psychiatrist that was pretty much experimenting with me with his, different attempts at controlling anxiety with antipsychotics. Do you know I've actually talked to um, other psychiatrists, and the type of anxiety that he diagnosed me with, they haven't even heard of, and they completely disagree with treating someone with the type with anxiety, simple anxiety, with antipsychotics. But this guy was the only guy that I had in my phone. And a couple years ago, I had a situation where, I needed to talk to someone and I needed to talk to them bad. And it was, a lot of personal things. I had learned something, someone had hurt a friend of mine and in a very bad way. And I was absolutely pissed off. I was in a bad state and I needed to talk to someone to talk me down. Because the person that had hurt this friend of mine, you know, it's very, very personal, but I needed someone to talk to because I was very livid. I was very pissed. I was, about ready to go out and kill this person. And so I call this doctor and I call his emergency line because he is a psychiatrist. I know that he's a biological not biological, he deals with the chemical, what do they call them? His specialty is giving you pills, pretty much. But he's the only psychologist that I had on my phone. So I called him, called his emergency line. He says, okay, well, I'll go back to my office and look at your file and get right back to you. 2 hours later, he calls me and asks me what's going on in a very pissed off tone. And I start to tell him. He gives me like maybe a minute and a half to explain. And he's like, well, that's not my specialty. You'll need to call blah, blah, blah. He didn't even say the name clearly enough so I could make it out. And he hangs up without even waiting for my response. Oh, man. I went from being extremely pissed off at the person that hurt my friend to really pissed off at the doctor. So probably saved the other. It did what it was supposed to. It calmed me down for that one person. But now, this guy completely just, that's why I've got a sour taste in my mouth when it comes to doctors. I was in a bad spot at that time. And I needed someone to talk to. He was a psychiatrist that I had a relationship with and I was willing to talk to. I didn't have a very good relationship with him because of the pills, but I never expressed that to him. So for him to do that and not even, it was, at that point in time, it was an emergency. I had never called him in that aspect before. I had always set up an appointment. I know that emergency number is for a situation that is a true emergency. And, I was at the point where I needed a psychiatrist, someone who could help me through an extreme crisis. It was bad. And he hangs up the phone like that and doesn't even give me a chance to, get the information to the people that he recommended. And he said their names so fast that nobody would have been able to make out who he was talking about. He was just pretty much blowing me off in the most assholic way he could have. And you wonder why I don't automatically assume that the next doctor that I go and see is going to be like that. But it has soured me to the point where I want to know what the hell they're doing. I want to know why they're prescribing me this. And I do my best to still, not assume. And I'm always, I consider myself a really good patient if I ever go in and talk to doctors, because I don't give them a lot of crap. And I give them all the information they need. I don't hold anything back. And, I the only time that I ever get kind of picky is when they want to prescribe something or they want to do a procedure. I want to know why. And if it's a chemical, a medicine that would alter my my chemistry in my brain, I won't do it. But like I said, there are good doctors out there. There are complete assholes out there. And there are people that, are in between. And unfortunately, you get that in every profession. You get the good, the bad, the evil. You get the great, the good, the bad, and the evil. There you go. And unfortunately, I've experienced them all. Doctors, it's become too much about the paycheck and less about the patient. Back in the day when doctors were doctors because they wanted to help people and they didn't make a very good living, those were real doctors. And nowadays you still got people out there that join the profession to be, to help people. But then maybe the system ruins it, or maybe there's certain people out there that they've survived the system. And then there's certain people out there that just absolutely got into it for the money, and they're just assholes. Like the ear, nose, and throat guy. That guy, he was in it for the money, and he complete ass. Hopefully I can say that on all these videos, because I have cussed up a storm, and I'm sorry. I only cuss when I'm getting irritated, frustrated, or pissed. And this is about as mad as you'll ever see me, because I don't get mad. I do get mad. I just don't, I never lose my temper. And this is me probably at the worst you'd ever see me. But I have talked your ear off for 27 minutes. And just kind of vented and expressed a lot of frustration with the medical system, all because I went to donate plasma, or I guess it's really not donate plasma, sell plasma. I hate when people use donate plasma when you're getting paid for it, because you're selling plasma. I know that the plasma centers, make it, you're donating, you're saving lives, and you are. But you're selling your plasma. There's a difference between donating and selling. And both of them help people. So, I went in to see if I could make some money off of it, but turns out I'm not going to be able to, so I'm just going to continue donating blood. It would have been nice to be able to get some money out of donating plasma. But since I can't do that, I'll just continue to donate the blood like I normally do, and just do it because of the people that it helps. Would have been nice to get some money for the plasma, though. I could really use money right now. Okay. Well, now that I've talked your ear off about doctors and bad medicine and good medicine and frustrations, I'm going to go for my walk.